Good afternoon, everyone. So again, welcome to Kenya for all those traveling from other parts of the world. I want to share our journey. But before I do that, I would request that for a very brief moment that we all stand and pay tribute to a Kenya Red Cross volunteer, Mr. Samuel Wangila, who's part of an elite Red Cross action team, and he gave the ultimate sacrifice recently while performing an aqua rescue operation for a 16-year-old who had been washed downstream in Nairobi. So kindly, if you can just a minute. Thank you. Thank you very much. It's the stories of volunteers, heroes like Samuel Wangila that keep pushing us, keep allowing us to do what we do every day. May his soul rest in peace. Okay, so allow me to start as most of let me start with a phone call. I was in campus. I received this phone call. It was a phone call from the Kenya Red Cross headquarters saying, come help us with some digital, give you a... I did not know what to find. All I knew is that I was excited for this opportunity, and I knew that there will impact involved. What I found were hundreds of thousands of volunteers with no system to track them, Excel sheets being shared back and forth in emails, data being lost, every staff transitioning to another role, or every time a staff resigns, only for data being found somewhere in some physical document or some fragmented system. We had a lot of digital enthusiasm, but very little digital governance. So fast forward today, I'm here speaking on the behalf of Cross. Be here today. I hope I'm audible. Okay, thank you. So, for the longest, Kenya Red Cross has been very innovative. We have been very receptive to innovation, especially digital innovations. Our volunteers, our staff, our leadership. But innovation without governance is just expensive chaos. And that's where we found ourselves. We accumulated so many systems over the years, and all of these systems were doing different things. We had a system for volunteer management. We had a system for finance and HR. We had a system for beneficiaries. As at March last year, we had a total of 54 systems. All of these systems were not integrated. None was speaking to each other. Not a single one of them was speaking to each other. And very quickly, staff started falling back to the manual way of doing things. They were going back to their WhatsApp groups. They were going back to their manual registers. They are going back to the Excel sheets, because at least those ones worked. There was no hassle for having to remember your password for a certain system, having to download data from this system to take it to another system to analyze and then report it into another system. That hassle was not there. There is a lot of data duplicity. All of these systems, even though they do different things, they have some common standards. A lot of data duplicity. So with this, we seriously had to change this. The time it took to make simple decisions by tracking data across all these platforms is just time that we cannot afford to lose. And something interesting about Kenya Red Cross that I would want to share with you that is perhaps not the same with many organizations is that for us, time does not always translate to money. Time translates to life. For us, time means life. Every hour we delay deploying a volunteer means a family out there somewhere has delayed, the support that they need to receive has been delayed longer. And perhaps that is the support that they need to survive. Every time a surge operation has been delayed or derailed is an operation that is just taking too much time that it ought to take. Decisions had to be made. We had to change how we were operating. And that we arrived at a decision where we had to take seriously, we had to really take seriously this matter of digital governance. And we had to identify a technology that would allow us to do our operations efficiently and effectively. In the conversations that we had a long list and we had a lot of debates, but we agreed on a finite list, and these were some of the key non-negotiable things that we decided to move forward with. Number one, we had to have a system that works for us, not for a donor, not for the vendor. Kenya Red Cross is a donor-driven organization. That means at times, in order for us to get support to support our communities, the support we get comes with caveats, where we have to utilize a certain system or to utilize a certain vendor. We are saying no more to that. We have to get systems that are sustainable for us in the long run. Past the project implementation, we need to have a system that is able to meet our financial needs. We have to have a system that our small tech team can deploy and maintain on our own. And then this is something that most people don't speak about, but other national societies that have even less budget and less engineers, we want systems that they are able to adopt so that they do not have to suffer the same fate that we have. Last but not least, and most importantly, we want to avoid vendor lock-in. We want to avoid the situations where a call comes from a vendor and tells you, hey, look, you see that new feature that you have requested, it will cost 4 times as much as we quoted, because they know that we have been using their system for 3 years, all our data is there, we know no other, they have us locked in. And we definitely don't have any other option than to go with that. So, never again. Our exploration journey led us to Frappe framework and ERP Next. We tried a couple of others, and our journey led us to Frappe framework and ARP Next. And that was the beginning of a very exciting journey. Number one, the reasons why we settled for the Frappe framework. It's open source, completely open source. There are no caveats. It integrates with almost anything. So most of our systems that we had were not integrated. But then here is a platform that allows us to do that with the active community that it has and the excellent documentation. And then what we also liked is that for most of our needs, with just a few buttons, it already meets 60 to 90% of our needs with little or no code at all. And then, of course, there is the issue of vendor lock-in. The code belongs to us. Whatever we have developed is completely our own. And then there is the community, the people in this room, and others perhaps who are watching elsewhere. It is genuinely an amazing community. We have been able to get a lot of support, and I'm speaking genuinely because from experience of an organization that has been implementing proprietary technology in isolation, this community here is something to be proud of. So we could not go it alone. We went with Navari Limited. Navari Limited is a certified Frappe partner, as you all know, and they have been exemplary in supporting supporting to kickstart our journey. But then the goal was never to depend on one partner. The goal was to build internal capacity at the Red Cross so that we are able to handle these issues ourselves. The goal is ultimately to build a community that will help us develop something that is greater than us, something that is greater than just Kenya Red Cross Society. This is the first step, of course, to a much larger journey. Allow me to share with you our very first implementation that was developed by Navari. We are calling it 1RC Volunteer Management, Volunteer Membership and Management System. The 1RC part is a concept that we have where we envision a Red Cross, Red Crescent movement where a volunteer, a staff, a partner only has one access and they're able to get all the services that they have. So this is, VMMS will be a component of 1RC. This volunteer management system for a volunteer-based organization in Kenya that has been in existence since the 21st of December 1965. For all those years we've been dealing with volunteers. Volunteer management has been a menace for us. We have tried systems, we have tried Excels, we have tried CRMs, but all of them had some issues. Either it's a partner who felt they had us and then they started charging us exorbitantly for new features or even support, or just other systems that did not work as well as we expected. Frappe framework and ERP Next, and of course with Navari pulling the strings, was able to get us here. The current volunteer management system that we have, it has quite a number of features. The entire full life cycle coverage, from recruitment to registration, trainings and certification, membership management, deployment management, analytics and reporting. All of this we have gotten in one package. We do not need to go elsewhere to do anything that we are doing. So the surge deployment part is actually one of my favorites. So what used to happen was that in times of disasters, like you guys remember the March, April, May rainfalls in 2024 that was so devastating in Kenya. And perhaps I don't even need to go that far back. Currently, we're already having a crisis in Kenya. We are having floods and we are having drought, sometimes at the same time within the same counties. In order for us to efficiently address these issues and to support our communities, we usually need boots on the ground. But then you're not able to send a volunteer to do an aqua rescue if that volunteer does not have the adequate skills to do that. So this platform is helping us currently to keep a pool of professional volunteers. We are able to know, for instance, if the weather forecast, if the weatherman tells us that we should anticipate flooding in a certain area, we know flood comes with people being washed away, and then there are all these opportunistic diseases that come. So instead of waiting until that time, then we start start recruiting for people who know how to swim, people who know how first aid. We already have a pool of professional volunteers, and it's just a matter of deploying them, sending a deployment request via the system. If someone is available, they accept that request and they are able to go and respond. All of this has been made possible by Frappe Framework, ERP Next, and the support of Navari. This is an example of a screenshot of how the platform looks. So this is the profile page. That person on the profile is... Yeah, so as you can see, we collect quite some biodata. There is health and disabilities, qualifications and skills, and quite a number of other things. This is how it looks. But then, I'm not here to just show you the technology that we have created. I'm here to also perhaps request or ask all of you. The humanitarian world and the Red Cross in general, we have had and we have seen quite a lot. And the technology needs, we need someone or people who understand technology. We need people who understand that good systems do not need to be locked behind expensive subscriptions that small non-profit organizations are not able to access. And here is an opportunity for most of us to actually participate and support. All we need from you is one feature proposal. We need you to propose one feature. We need you to make reviews for what we have created. We need just one idea. And that is all from you to make a difference. We have already created the volunteer management system. It's on GitHub. It's free. Go, take it, use it. See what is broken. Tell us what we missed. Help us improve it. If you are a Red Cross, Red Crescent National Society, I know we have the International Committee of the Red Cross here, and you have an organization that manages volunteers. Here is what we have created. You can come talk to us, or better yet, you can go it and you can utilize it. If you are a developer, and I know we have so many here, if you want to make commits that matter, then talk to us. If you are an implementing partner, and I know we have very many of those here and others who are watching, talk to us. You can connect with us via this QR code, or you can send us an email via digital@redcross.or.ke. And all the systems that we build will be released as free and open source. Before I leave, I would want to perhaps announce something that for a long time, Kenya Red Cross has been a recipient a recipient and a client. We have been a client of technologies that have been created elsewhere for needs that have been defined elsewhere. But we want to change that. I am very happy to announce the entry of Kenya Red Cross into the Frappe community. And we are not just entering the community as a client. We are a client to most of the partners that are here, but we are also joining the community as a service provider. A service provider to the Red Cross, Red Crescent movement, to the Red Cross, Red Crescent national societies that are out there, a service provider to the humanitarian non-profit organizations that are out there, and of course to this. That phone call that I received completely changed things. I had been asked to come and support with digital innovation to help manage volunteers and to help engage young people. I'm happy to report that we have built the system to manage the volunteers. We have developed the system to deploy them. Now help us build the community to sustain those innovations. Thank you very much. Any questions? Yes.
Yes. Thank you for this awesome presentation. That was really nice, and I hope you all enjoyed. Yeah, I have many questions, but you have answered most of them already. So one question is, there are areas where there is no internet, okay? So for us, let me introduce myself first. Then my name is Abir. I work for a company called BJX Limited, and we operate in South Sudan. And we have been working on this non-profit software development for last 6 years. And we are part of Frappe community for last 1.5 years. And we know we know the challenges that the non-profit organizations they are facing. So one of them is running the system in offline. So most of our clients, they ask that we have field locations where there is no internet connection. So can you develop something for us which can work offline, and we'll save the data while we are in offline, and then it will sync the data while we go online or we get connected to the Wi-Fi. So do you have any plan to implement that? And also, if you can reiterate on your on the plan of your scaling, like it is only for volunteer management. So what's your plan next? Like if you want to develop the system for the organization, like to manage everything, starting from the requisition of the fund up to the implementation. Yeah.
Okay.
Thank you.
Thank you. Thank you very much. I love questions because they give you the opportunity to say so much that you did not have time to say. So the Navari team has been gracious enough to include a progressive web application, the exact version for that implementation. And as I understand, it has some offline capabilities. So there are some features that are actually available offline. Over and beyond that, we are currently developing USSD solutions that will complement whatever we've created. If you're on your phone, you can try *384 *84 hash. I'm not so sure whether it's currently working, but it's something that we are actually working on to address the offline volunteers and members that we actually serve. On what is next, we actually have a suite. Remember, we had 54 systems that we had to, that were, the journey that we are on right now is a journey to bring all of this together. We have internally, we have already trained a workforce of volunteers and staff, and on our own, with the support of Navari team here and there, we are already developing some of these solutions. Things like donations portals, things like beneficiary management systems, things like internal tools for us like community-based surveillance systems. So all of these are actually on Frappe, and they are actually interconnected. Ultimately, perhaps to completely move and perhaps even start using ERP Next as our full ERP. But we have a lot of data dating back many years for other ERP, and perhaps will slowly transition. Right now, we are focusing on collapsing the 60. Right now, it's actually somewhere around 45 systems into one RC. Thank you very much.
Yes, Kevin. Congratulations on a good job, well done. I wanted to ask more about use cases, and you've been kind enough to mention that. Where I want to ask is, have you thought about for where we cannot move away from other systems, and maybe also to the Navari team, now that you work with national societies and other Red Cross, what would be the answer to integration with pre-existing systems, to donor systems, to different, probably, countries who are using other systems?
Okay, thank you. So perhaps I can take all the questions and then address them in one breath.
Hello. Hello, everyone. My name is Enoke. I don't necessarily have a question, but rather it's a statement or maybe a comment. I am the founder of a small company called BWK, and what you're doing is we are making customizations around the Mali healthcare repository from I think the Mali group, to provide telehealth solutions to hospitals within the country, where we give them features to our video consultations between the different facilities they have. And I was wondering whether you guys with the Red Cross Society, because of the works you are in, whether wanted to ask whether we can have some sort of, we can bring some of the expertise we have to what you guys are doing, provide virtual consultations and video consultations. I'm not really sure whether that's something you've thought of, especially for remote areas within the country, but that is something we are working on, and I wanted you guys to, if that's something you'd want to maybe try out to work with, we can have a conversation around it with you people.
Thank you very much. Okay, so when it comes to integration, there is no avoiding integration. And especially even for us, I have already made a bold speech here about how we are going to say no for this system and that system. But the reality on the ground is that some systems that we have are not going away anytime soon. So we have to slowly transition out of those systems. So what we are currently doing is we are identifying that whatever is important and whatever needs to be integrated with whatever we are creating, we are ensuring that it's being integrated. For most non-profit organizations that we deal with a lot of data collection, there are these ODK-based tools like Kobo Collect. That is a tool that the Red Cross, Red Crescent movement primarily uses. So we are not getting away from that anytime soon. What we have done is that we've been able to build an integration between Frappe framework and Kobo Collect. So data is collected on Kobo and it automatically pushes that data to Frappe framework. That actually sounds cooler than I have just said it. But then this is a reality that we have. Even currently, whatever Navari has helped us create, we have, when we engage volunteers, from time to time we indemnify them. A little token of perhaps the fare that they used to get to the area that they need to perform their duties, or this and that. So we have to pay them. So the payment, our payment platform currently is a different ERP solution that we've been using for many years. So because our finance processes cannot just move in a day, there is integration that needs to be done. So that is also something that we're still considering. Yes.
In this business that we're in,
Mm-hmm.
how are you ensuring data privacy and with all these data laws, also working with Moshai, his team, how could you speak a little bit about how you are able to ensure there's privacy about beneficiary details, this information?
Okay, thank you very much. So we have this animal within our organization called systems audit that keeps breathing down our necks anytime they hear that we are creating a new system. And this is the team that actually helps us, shape anything that we are creating. And we have very solid data protection policies within Kenya Red Cross. We are dealing with volunteers. We have health systems. We are dealing with refugees, and we are dealing in places with refugees with partners like UNHCR, and we cannot just afford to downplay data protection. So we have a lot of, we do a lot of consultancy with this, like we have very close connection with the Office of the Data Protection. We get guidance from UNHCR in the event that we are developing a system with them. So this is how we actually ensure that nothing has been overlooked. And before before we start creating a system or before it goes live, we ensure that we do what we call a data protection impact assessment. Thank you very much. Last, to address the remark from behind there, I am happy to see that my call for you to join us is already starting. Yes, we are very willing to have conversations. Yes, we are very open to virtual consultations. Please reach out. Thank you very much. Back to you.